CPA. This afternoon, we're joined by Laurel Beaton. Laurel spent her career working on retirement income policy as a researcher, writer, speaker, and educator in academia, government, think tanks, and the Hill. In retirement, she continues her policy work part-time and is a member of the English Department Alumni Advisory Board at Virginia Tech, where she received her doctorate. Laura, welcome, and the floor is yours.
Thank you, Angie, and I'm complimented to be here. Thank you so much. And I always throw in the English major part because, you know, there are always jokes about English majors and how when they graduate from college, they learn to say, do you want fries with that? And so I like to let people know that there are some English majors who are not working saying, do you want fries with that? I get to do policy work and I really love it. I love thinking about retirement and the economics of retirement. I did have a lot of statistics with my degrees as well. So that was very helpful. And today what I want to talk with you about is the financial stats and steps for caregivers. And so if I could have the next slide, please. Thanks. I want to tell you a little bit about Wiser because this is where I am doing my volunteer work. Cindy Hounsel invented Wiser, Women's Institute for Secure Retirement, because women on the ground didn't know about how to plan for retirement. And there are lots of think tanks and lots of us who research and lots of us who can tell you numbers about it. But Cindy actually said, women need to know. So Wiser provides women with basic tools and financial information so you can take control of your own lives. Wiser operates the National Resource Center on Women in Retirement Planning with the U.S. Administration on Aging. Also, and this I'm going to read from my notes so I get it absolutely right, we just announced yesterday that Wiser has set up a caregiver portal. And this caregiver portal is a one-stop online shop that will provide financial information and resources to caregivers throughout the caregiving cycle. So if you go to the Wiser website, which is wiserwomen.org, and go to the caregiver page, there is all kinds of information available for you. And I know because I was a caregiver both for a spouse with the bed in the living room and for two parents who lived in St. Paul, Minnesota. Luckily, my brother lives in St. Paul, so he could tag team me with the on-the-ground work. But there were an awful lot of things, even working in the field, that I didn't know and I had to find out about. Hopefully now this caregiver portal will be available for those of you who are looking for more information, and you can click the button and find the information. Okay, next slide, please. This is the one that always scares people, but it's important to be scared because it helps you think ahead of time. The average cost of care. Average total cost for dementia, and I know I just started updating these numbers, so they're even a little higher now in 2021, but this is good enough. This will give you a feel. Almost 290,000 for someone with dementia, 175,000 for someone with heart disease, almost 175,000 for someone with cancer and other causes, close to 200,000. Out-of-pocket spending for patients. Now, this means these are things not necessarily covered by insurance or Medicare or Medicaid. For someone with dementia, 61,500. Without dementia, 34,000. And there's a similar pattern for informal care. Note again, many expenses are not covered by insurance. Next slide, please. the cost of care, and the red numbers show the increase between 2018 and 2019. For adult daycare, and most counties have adult daycare centers. You can generally use it a day a week or maybe all week, depending on how you work it. The national median in 2018, the monthly cost was $1,500, and that went up by 4.2% in 2019. Nursing home, and remember, daily costs vary by state. It's probably going to cost much more here in the Washington, D.C. area than it's going to cost in Iowa or North Dakota, but it's going to cost a lot in California and New York. The national median monthly cost for a shared room, this is 2 people in the room in a skilled nursing facility in 2018, was almost $7,500, and it has gone up almost 1% in 2019, and it's gone up again in 2020. Senior living or assisted living residences, and that's memory care residences. Again, the costs vary by state, but the national median monthly cost is $4,000 a month. And then potentially there is added cost for dementia care, and that has also increased in cost. And I know my mother lived in, after my dad died, lived in an assisted living residence, not memory care, but she's an assisted living residence, and it was well more than $4,000 a month. Next slide, please. Again, cost of care. Now let's flip over to non-institutional, if you will, at-home care. The national average, and this was 2016, these are the best numbers I could get, but up this a little bit for current numbers. Homemaker services, this is someone who would come in and provide some light housekeeping, maybe cook a meal or two, maybe just help talk with the individual if you're not able to be with the person that you're caring for. A home health aide is $20.50 an hour. Again, that's the average. Now that would be someone who might come in and give an insulin shot to the cared for, or change a dressing on a bruise, or check oxygen levels. This is definitely a person who's providing healthcare, visiting nurses kind of thing. Now, the national median numbers for homemaker services per month, $4,000 and up 7+% in 2019, and a home health aide, again, $4,000 per month in 2018 and up almost 5%. So those are the costs for if you have to pay for your own care or for the care of a loved one or a friend. Now the biggie, unpaid care, and this number has gone up. Family caregivers spend now, the new number is $7,400 in out-of-pocket costs each year. That may mean if you go to visit your neighbor who is at home but needs help, you stop by and you bring dinner, or you note that she needs her prescription picked up, and while you're there, she needs detergent to give to the homemaker services person, and you end up paying for some of these things. Over time, that comes up to almost, about $7,500 out of your pocket a year to take care of a family member or a friend over 50. Next slide, please. And who are the unpaid caregivers? 34.2 million Americans provide unpaid care to a relative or a friend aged 50 or older. This number has gone up now. It's 61% of women. And just to make clear here, we really are focusing on women for the reason that women earn less. Women are in and out of the labor force providing care more than men, so the financial impact on women is much higher. But 40% or 39% of caregivers for older individuals are men. So we're not leaving men out. We're just saying that financially it's harder on women. Nearly 50% of caregivers for this group of older people spend 8 hours each week providing care. Now, if you figure you work an 8-hour day at your paid for employment, you know how long that is. Now, that may not be 8 hours at a time. It may be you spend your 8 hours at the office and then you come by and check on your mother or your friend for an hour every evening, or every other day you come and spend 2 hours. It's a lot of time. More than 20% spend more than 40 hours each week providing care. That's a full-time work week. And on average, caregivers spend 4.5 years providing care. Next slide, please. And the financial impact of being a caregiver. 60% of caregivers report making adjustment to their work. I may be so tired after 8 hours of work, I need to cut back on my hours so that I can spend those 2 hours taking care of my mother, seeing that she's all right. Or if my mother, say, fell and broke her hip, that is a personal example for me, and it was snowing like crazy here in Washington, and of course in Minnesota, it was snowing like crazy. I had to get a plane. I couldn't get a plane early. I had to get a plane to get there. So I had to pay more to get on that plane. I get there in a snowstorm. Oh, and by the way, little side story, and it's very, very humorous. I wore my big red down coat, and I get to the airport and I get my rental car, and my mother is in this beautiful St. John's Hospital, but that is on the other side of St. Paul. I drive through snowdrifts, really. I mean, there was a lot of snow. I park at the hospital. I get there. I go up to my mother's room, and she's in the bed. She's got, the tubes in and out of her. They were making her walk. She really recovered from that quickly. They did a magnificent job. But she looks up at me from her bed, and here I am. I've been on the plane driving through the snow. And she says, I've never seen a coat like that. And I thought, I drove all this way. You have to take leave or take vacation to fly to Minnesota. And sometimes if you're doing full-time care for your mother or your father or your spouse, you need to take more than several days. Also, it may be that you're so tired you're falling asleep, or you have to leave early and your colleagues are starting to complain about it, and you receive warnings at work. 60% of caregivers are reporting this kind of adjustment. Caregivers pay over $7,000 annually in out-of-pocket costs for caregiving. We've talked about that. And here's an important one. Caregivers lose more than $300,000 in wages, Social Security benefits, and private pensions over their lifetime. In other words, very obviously, if you have to take more time than the vacation time you have, FMLA, the Family and Medical Leave Act, kicks in, but that's unpaid leave. In other words, they can't take your job away from you, but they don't have to pay you if you go over those time limits of your vacation or your sick leave. Social Security, on the other hand, if you're working, you pay 6.2% of your wages up to the limit, and your employer pays 6.2% of that up to the limit, contributing to Social Security. So when you retire or become disabled or die, your family and or you will receive a benefit. But if you're not contributing, you receive a lower benefit, because Social Security benefits are based on 35 years of work and contributing. And if you didn't contribute for 35 years, then instead of averaging 35 years, they're going to be zeros to make up to the 35 years. Private pensions, if you're lucky enough to have an employer that provides a private pension, the same thing happens. You lose time having your employer contribute to your private pension for you. Next slide, please. Some less obvious examples of the costs of caregiving are reduction in your personal savings. Hopefully, every one of you, if you are a federal employee or a state employee, you're contributing to the savings plan that is offered there, and or you're investing on your own. Maybe you have an employer who provides a 401k. 401k earnings grow. So $25 invested in 2021 and taken out in 2050 is going to be a lot more than $25 invested in 2040 and taken out in 2050. You get the idea. Oversimplified, but true. The other thing is, if you're lucky enough to own a home, because you're spending money in other ways, you may not be able to finance home improvements that could help increase the resale value of a home, or it may mean that you will not be able to buy a home on your own. Next slide, please. So, money mistakes that caregivers can make. Not making your own finances a priority. And that's something that's extremely important. And I give this warning to everyone. You know, on the airline, when they come down the aisle, the flight attendants come down the aisle, they have the seat buckles in their hands and they have the little yellow cone that's the oxygen mask. And they say, if something happens to the cabin pressure, the oxygen mask will drop down, and be sure and take care of yourself before you take care of your child or the person who you are taking care of. And the old airline joke is that if you're traveling with more than one child, take care of the child who is going to take care of you first. That's what I say about not making your own finances a priority. Do please take care of yourself. It's important, and it's not selfish. You can't help someone else unless you're feeling comfortable yourself. Paying for the cared person's everyday expenses, such as purchases at the drugstore and at the grocery store, are fine. I used to buy my mother's clothes when she couldn't get out, or when it was very hard for her to get out and try on clothes, and I would buy them and bring them to her, and I would say, oh, don't worry about it. But if you're in a financial situation where you're trying to save and do these things to protect yourself, look to your future, think about, are there other ways that things can be paid for? And we'll get to that in a minute. But don't try to pay for everything when you personally can't really afford it. And I'd like to give a little private advertisement here for Wiser. If you go to the Wiser website, there are all kinds of there are cheat sheets, there's all kind of fact sheets and information about how to save. And I know so many times you say, oh, I can't save a thing. I'm just stretched to the end. But I think there are things that probably we all can do. And that makes it easier to save. And once you get into that habit of saving, or if you get a pay raise, or if there is a windfall, or if you see $5 lying on the street, um, put that in a savings account. You really won't miss spending it. Save it and it will make a difference. Again, following that is not realizing that you may end up in the same situation as the person you're caring for, and you will need to pay for your care. And caregiving is getting nothing but more and more expensive. And saving less for retirement specifically because you're helping everyone else. And here's another thing that disturbs me. I know so many of us, we have grandchildren and say, oh, I really want to help my grandchild out. And there are those wonderful 529 savings accounts for college, for children and grandchildren. And that's wonderful if you can afford it. But I know people who are taking money out of their 401ks or out of their savings, their simples or their SEPs, their various savings accounts, and they're giving it to their grandchildren for their educations. Well, here's my thinking about that, and I'd like you to think about it too. Believe me, I don't have the cool answer for everybody, but I do have some thoughts. Will you be able to get a job to help you when you need money when you're 85? And the answer is probably not. But will your grandchildren be able to get a job when they're 30 and need money? Yeah, the answer is probably. So think about how you are taking care of yourself before you take care of everyone else. I'm not saying not to care for everyone else. Please do that. It's incredibly rewarding, but you don't have to pay for 4 years of your grandchild's education. There are all kinds of other ways you can be good to your grandchildren. So next slide, please. There we go. Financial steps to ensure caregivers while giving. So now I've given you all of the downs. Here are things that you can do. Think carefully about the potential consequences of leaving a full-time job and working part-time. You know, my knee-jerk reaction, and I'm sure it is the knee-jerk reaction of you and a lot of people you know, is when your mother falls and breaks your hip, you have to quit your job and fly to wherever and move in and take care of your mother. Or you have to say, I have to work only part-time, maybe 30% time because I need to spend this time with my mother. Well, here are the things that you don't think about and you need to think about, which is, one, you've reduced your income. Can you afford to do that? You'll probably lose your health. Well, if you leave your job, you'll definitely lose your health insurance. And even if you have COBRA, which is the legislation that bridges from one employer if you lose your job to the next, and it gives you 18 months of health insurance from your former employer. But remember, when you were working for that employer, both you and your employer were paying into the pot. When you're not working for that employer anymore, you have to carry the full payment load. So what it says is they can't cut you out of health insurance for 18 months, but you still have to pay for it. So that can be a real kick in the kneecaps when you're not realizing that's going to happen. And again, future benefits. So think about, are there ways Can I negotiate with my employer? Are there programs that will help me take off part-time and not lose my health insurance? And again, future benefits count into this. If you have an employer provided pension or a 401k or the opportunity to contribute to a savings plan, how will reducing your work time or taking off altogether cut into those things? And will you be able to sustain yourself to then be able to provide care? So accessing other resources. Don't be solely responsible for providing care. Ask for help. And obviously, you want to talk to your family, if there is family, or the family of your friend, to set up family care agreements. And I'll talk about that in a minute. But as well, and here's the advertisement for Wiser again, there are all kinds of resources, and there are all kinds of resources at the back. There are clicks and websites for you to go to get this information. Make a formal plan for managing your own money and saving for retirement. And also think about helping the individual you're caring for make a formal plan so you both know where you are, and plan for your own retirement needs, income, healthcare, and housing when you reach retirement age and want to leave the labor force. Next slide, please. Now, what everybody says, well, Medicare will take care of me when I get sick, and Medicare will take care of me when I'm in the nursing home. Sort of. And here's what you need to know. I'm looking at my watch, so I may have to start talking faster here. Medicare does not cover long-term custodial nursing home care. In other words, if you have a parent or a friend who needs to be cared for 24 hours a day and you're not doing it at home by yourself, don't assume that Medicare will do it. Medicare covers up to 100 days in a SNF, a skilled nursing facility or nursing home, after a qualified hospital stay. And that's very important to understand that. Again, if the person has broken a hip, I keep going back to my own experience, or in my spouse's case, he had terminal cancer, but he was in the hospital. He had lung surgery to make his life easier for the last 6 months. That was a qualifying hospital stay. He could have stayed in a skilled nursing facility. Medicare pays for, while the person is in a SNF, for regular medical care, which is the Medicaid care that would be provided by a doctor's visit, that kind of care, but not, again, the custodial care that is provided in a nursing home. Now, if, as we did, we went home, put the bed in the living room, Medicare provides for 60 days of home health services if the person is homebound and requires physical, occupational, or speech therapy or intermittent nursing care. And this was certainly the case. But note the note at the bottom, and again, this is very important, you have to have a Medicare enrolled physician saying that you certify as needing these required services. So keep these things in mind as you're saying, well, Medicare will cover. Medicare covers some of it. Next slide, please. Special needs plans. These are wonderful. They are relatively new. They are part of the Medicare Advantage plans. Those are Part C. Those are the biggest provider of Advantage plans is Kaiser, where everything is done under one umbrella. And SNPs are available for individuals with dementia. They provide all the care that Medicare Advantage plans and are required to provide, as well as, and this is what's important about these, the extra services tailored for people who have dementia so they can stay in their homes longer. Now, to qualify for this, a person has to be 65 or older, a US citizen or legal resident for more than 5 years, have Medicare Part A and Part B, and that, Medicare Part A is the hospital insurance, and Part B is what you pay the premium for. That's your doctor, if you have to have your appendix out, I had to have knee surgery, that kind of thing. You live in the planned service area. Now, SNPs are not available in all parts of the country. That's important. It may or may not be in your state, and meet the plan's eligibility requirement for a severe or disabling chronic condition such as Alzheimer's or other dementia. There are many kinds of dementia. But it's worth, if you have a family member or a friend who has dementia or Alzheimer's, this is worth looking at. Next slide, please. Potential supplements covered by SNP's modification for home safety, such as bathroom grab bars, and I recommend that for everybody. I had bathroom grab bars put in, and I can't tell you how wonderful they are, because when you have soap in your eyes, there's nothing more wonderful than being able to reach out and grab that bar so you don't slip and fall. Non-medical home care, such as someone who helps with bathing or a homemaker who prepares meals. Adult daycare that provides a safe environment with counseling, meals, activities, and behavior management. And remember, we looked at the cost of adult daycare, and the SNPs provide some help with adult daycare and memory care and assisted living in communities that focus on people with advanced Alzheimer's or dementia. So this is something to keep in the back pocket if you know someone with or who has been diagnosed with dementia or Alzheimer's. Next slide, please. Medicaid. Now, this is the biggie, and this is where an awful lot of people who are in long-term care facilities are being paid for by Medicaid. But understand what Medicaid is. First of all, it is a joint federal and state program. It finances healthcare services, and underline this, for people with low income. In most states, and I think there are only 11 that don't, there are 209B states who qualify for supplemental security income, SSI, are eligible for Medicaid. Now, SSI is a poverty program. It is not paid for out of Social Security. A lot of people think it is. It is not, but it is administered by the Social Security Administration. If you qualify for SSI, in most states, you are automatically eligible for Medicaid. Now, in 2019, and I apologize for not updating this, the monthly federal payment standard in 2019 for SSI was $783 for one person and $1,175 for a couple. So you're not living the glorious life if you are qualifying for SSI. Now, states have the option to provide Medicaid to those 65 and older and people with disabilities with incomes up to 100% of poverty. SSI does not even come up to 100% of poverty. Now, those states, and I'm sure you've heard on the news, there has been a lot of controversy about what the states provide with Medicaid. So check the state that you're living in. Next slide, please. In some states, people with chronic illness or disability who require long-term services and supports but have income and assets above the Medicaid limits can qualify to receive long-term services and supports. LTSS, they are designed for an individual who requires a level of care equivalent to that of someone in a nursing facility. And these services can be provided in the home, in the community, or in a facility. But note here, eligibility is determined by assessing health conditions and functional needs of applicants. Now, the functional needs, dressing, bathing, toileting, eating, walking. So important to be aware. And next slide, please. Then I will say it on Medicaid. Some people think that all they have to do is take their income and asset levels and limits to qualify for Medicaid. And there's a $2,000 asset limit. That's it. That's all you can have. They're very strict asset limits. So some people think, well, I can just give all my savings to my daughter and then I can go on Medicaid. No, that's called, you have to spend down in a very careful way. So you need to consult with an attorney about how to do that. And I urge you to do that. And you can also look at the WISER website for places to find attorneys. And there are attorneys who will do this pro bono. There are attorneys who specialize in older workers. So take a look at that and be sure you understand. Now, legal agreements for families and caregivers, and I do have to start talking fast here, but this is really a cool deal because it's important and it's helpful. Family or personal care agreements are formal contracts that help manage caregiving. And they can be used whether you're a family member or not. Remember, back early on, I said you need to talk to the family and you need to talk to the person. And this is what that's about. If you have an agreement that says, this is what I'm going to do, and this is what my brother's going to do, and this is what this is how many hours we're going to pay someone to do something, or maybe my brother who lives far away, but I live near my mom and dad, but I'm working 40 hours a week, so it's killing me to be rushing over there every day. Maybe you can pay me so I can work part-time, and we can do that. And if we shake hands on it, that's all very lovely, and maybe that works out fine. But maybe it doesn't. And 6 months in, my brother has forgotten to send me the check. And if we have a formal written down agreement that we have discussed and we have all agreed to, that can help avoid family conflicts about who will provide care, how much care will be provided. And it's a really good way for everybody to talk about, well, I can do this and I can do that. Or maybe my son or daughter could come in and help grandma and granddad. So there are all kinds of ways that talking about these legal agreements for families and caregivers work. Next slide, please. Family personal care agreements should include, when are we going to start this? This is exactly what we're going to do. We're going to do it every Monday, Wednesday, and Friday. How much the caregiver will be compensated and if they will be. Now, if you go to one of these professional organizations, they have a set fee. So that's, you have to decide, how is that going to be paid for? Maybe mother has some savings, and maybe that's a way for you to help spend down your savings so you can qualify for Medicaid. Talk with your attorney about that. How long is the agreement in effect? What if mother's situation changes? What if she can't walk around with a walker anymore? And where will the services be provided? If she has to move from her home to a nursing home, um, how are we going to do that? And there's the biggie. I put that in color because it's important. Will there be pay, and how much? In a statement that the terms of the agreement can be modified by mutual agreement, you need to have that in there, and signatures by the parties. And if you want to look at that, there is also in the Wiser booklet on caregiving, and right here there is a way to get a form that will help you do that. Next slide, please. Legal documents for the financial caregiver. And I always tell caregivers, you don't have to be the person. You don't have to be the durable power of attorney for healthcare or the durable power of attorney for finances. But what you need is the pieces of paper that say, this is the cared for's living will, who the durable power of attorney for healthcare is, who the durable power of attorney for finances is, where is the will, where are all the documents that are needed. This is very, very important. And also, what are the passwords to the individual's computer? And maybe the cared for says, well, you're a great caregiver, but I don't trust you. I'm going to give them to an attorney or the person who has my advanced care directive, and that's fine. But as the caregiver, you just need to know where those documents are, so if and when, or maybe just when, the situation changes, you know where they are and you can reach these people. The advanced care directive is your living will. It makes clear your wishes. Now, a lot of times people say they can be ignored easily. They can, but it's making clear what you want. Do you want to be resuscitated? And if you don't say so, or under what conditions, then the durable power of attorney for healthcare, if you are not able to speak, or if you are in a coma, the durable power of attorney for healthcare can make the decisions for you. Don't leave those decisions to your family or your caregiver. That's a real burden to leave to them. Let them know what you want, and then they can do for you what you want. That's a real gift. And the same with the durable power of attorney for finances. If you are unable to make financial decisions, you give that power to this individual. And I say, you can die intestate, you can die without a will, and that beautiful Jaguar, antique Jaguar that you have been polishing for years, or that savings account that you have had and you want for someone to be able to go to graduate school, and it ends up going to your only living relative who is your no good nephew. Do you really want that to happen? So please think about these people and these documents. Next slide, please. And a living trust and a last will and testament. Again, the trust allows a trusted person named by you, the cared for, to transfer ownership or title of their assets into a trust. And the last will and testament provides final directions for your assets and your stuff. This necklace that I'm wearing is the little lavalier, was my mother's when she was a child, and I really treasure it. And it came to me, And my niece, my mother's granddaughter, I think was a little offended that I got it. And I said, well, what I do is I get to wear it now and I will leave it to you. And that's what a trust and a will can do. Again, that is thinking about this ahead of time and helping the person you are caring for ahead of time is a gift that that person can give to the people providing care. Next slide, please. And here is a list of the financial documents and account numbers for the financial caregiver. And I won't go through them all, they're here. So you can get this list, or again, go to Wiser Women and dig around in the website and see what's there. But again, be sure that you have access or that someone has access. Next slide, please. Filial responsibility laws. This is a biggie. I'll say it quickly. Adult children may be forced to pay for their parents, excuse me, under filial responsibility laws. Now, these laws vary by state. 27 states have laws that in some way obligate adult children to care for their parents. So I can see you all Googling now to see if your state is one of the 27. You can check with an attorney how they work. Every state does this differently. Get your family involved in how, if this is a biggie in your state, how you want to deal with this. Next slide, please. Professional assistance from financial planners. I'm going to skip this other than to say, please, if you are unclear or unsure, financial planners are a really good thing to have, but be careful. Again, your best friend's nephew may not be the best financial planner in the world, even though you like him a lot and he's your friend's nephew. This financial planning, there's a fact sheet on our website about choosing a financial planner and some tips on what you need to do if you want to do that. Next slide, please. End of life. Again, peace of mind for you and for the cared for. The advanced directives, have those in place. The power of attorney for healthcare, power of attorney for finances, last will and testament. Next slide, please. And that is the end. I think I talked really fast and I talked 5 minutes over my time, but I think that's pretty good. I am not an attorney. I am a researcher. So I leave by saying what I tell you is my thoughts. I'm not giving you the cool answer. I'm giving you things to think about to help you and your care, making your caregiving easier for you and the cared for. And I really recommend our website that's got lots of good resources on it. And Angie, I'll turn it back to you. You're dealing with questions.
Thank you, Laurel, very much for your thoughtful, thought-provoking presentation. At this time, we'd like to invite our participants to ask questions, to type them in the chat, and we will be happy to share them, as many of them as we can, with Laurel.
And I'll do my best to answer them. Some I will not be able to answer, and I'll have to refer you or get back to you.
Thank you.
And Angie and Ms. Laurel, I don't see any questions yet, but as any pop up, I will definitely let you know.
Well, I understand too that I have fire hosed you with information. I mean, we've gone from the cost of care to what you should do. There's also a fact sheet on the Wiser website about if you are providing financial care. Yes, you may have a copy of the slides. And there are all kinds of resources there and references to the slides. Can you catch us up when you've not taken advantage of retirement? I can't quite see it all. How can you catch up on?
I'll read it for you, Ms.
Oh,
Laurel.
thank you.
It says, how can you catch up, so to speak, when you've not taken advantage of retirement matches by employers because of ignorance and limited income?
Yes, well, and the limited income, and my big thing is we need to get financial education in high schools, at the very least, or maybe even in the grade schools to teach people how to save. At 55 and a half, you can, or at, forgive me, I'm forgetting the age, but there is a catch-up age for 401ks, so you can contribute more as when you reach, it's either 50 or 55, and you can start contributing more. Lack of savings, yeah, that's a catchy one. And let me add here, as a base of retirement income, which is safe and tied to the cost of living, Social Security is our best bet. And I say from the position, my position, but also Wiser's position and the position of AARP and all of the aging organizations, continue to support AARP, because that is the one pension that is going to be there. When you hear people say Social Security is going broke, it is not going broke. The trust funds are emptying out due to population, but Social Security will be there as long as people are working and contributing. Now, we do need to advocate for some change in the financing because we want to bring Social Security up to its contribution levels. So I think that's one thing that's very important for all of us, particularly for people who haven't been able to save due to low incomes or inability of opportunities to save. There are ways to save. And again, let me shuffle you off to our website and just put savings in the question box. And there are all kinds of techniques for things you can do that will help you save. Let me see. Now,
I have another question here for you that I'll read. It says, for nationalized American citizens who will not meet the 35 years work requirement, what resources do you have to recommend?
Okay, I will go. Have you worked in, the question is, have you worked in another country as well and contributed to Social Security? There's something called a totalization agreement. And what that says is, if I, as an American citizen who have contributed to Social Security here, decide to go to France and I work for a company in France and they contribute to the French Social Security system, and then I come back home and retire, those benefits from France and the United States are combined. They are totalized. So if you have worked for Social Security in another country and we have a totalization agreement with them, your benefits from both countries may be combined. So I recommend that you go to ssa.gov and look under totalization agreement, and that they should be able to help you. That I did some work. I was at the Office of Research and Statistics at SSA, and I did some work with the international stuff. It is very complex about who has the agreements. But if you have come over, if you are married to an American citizen, you qualify as a spouse for the American citizen. So there are all kinds of, my original country does not have a totalization agreement. Okay, so then that means, and you have contributed to Social Security here, that means that you will probably get a very low Social Security benefit. They will calculate based on the years you have contributed, and zeros will be added. But remember when I talked about SSI, Supplemental Security Income? Supplemental Security Income will top up your Social Security benefit to the SSI level. Not a lot, but it is something. And again, I suggest you go to your area association on aging and see if there are state or local benefits that also might assist you.
Okay, and Ms. Laura, I have another question here. And it says, if you have cared for a friend informally for about 8 months until the family started to care for them, is there a recourse to retrieve finances?
No, unfortunately, no, there isn't, unless you had, and that's another reason why those care agreements are so useful, that everybody knows front and center what's going on. And good-hearted people provide care. And I think a lot of times the family doesn't realize how much care, and I think you probably didn't realize how much care you were providing. But no, there's no way to go back and do that, unfortunately, other than, gold stars. And I give you kudos for that.
And are there any other final questions? We have about 3 or 4 more minutes here. If there are any other questions.
Something too, if you are providing caregiving for a friend, one of my good friends stepped off a curb, broke both her legs, not one, but two. So she was stuck at home with both legs splayed out. Both legs were in casts. And the friends set up a rotating spend the night. She did eventually, because it was in a workplace that this happened, and it was dark and there was no handrail. I mean, it was just a violation of workplace all over the place. She did eventually get an attendant to help her under workers' comp, but we set up this rotating friends thing. We had a schedule, and who would spend the night. So if Deborah fell out of bed on her face, somebody would be able to pick her up. It can be done, but here again, if you don't know, if you don't think about these things, when you just say, "Oh, my neighbor needs help," or "My friend needs help, and I'm just going to go over there," and you don't think about all the consequences. And kudos to everybody who is doing this. We all, spouses, parents, good friends, this is really important. So again, go to wiserwomen.org if you have a question that you're concerned about and you want to email me, email Wiser and ask for me, and they will send it to me. Go to Wiser Women and ask for Laurel.
Well, if there aren't any additional questions, Laura, we want to say kudos to you. Kudos to you for sharing again such a thought-provoking presentation. I'm certain that I can speak for all of our participants on the call that we've learned so much today, and we want to thank you, and we hope that you will come back.
Thank you. I would enjoy that. I really enjoy this because it's stuff I wish I knew when I was providing caregiving, and it's hard work. So I'm looking forward to hearing from you.
Thank you. And to all of our participants, attendees on the call, thank you so much for joining us this afternoon. And we invite you to look at NCBA's website at www.ncba-aging.org to take a look at our upcoming webinar trainings. Thank you again, and have a great afternoon all.
You too, all. Bye-bye.
Bye-bye.